Hi, I'm Savannah Fahey, and today I will be talking about probiotics and gut function. So let's begin by talking about what probiotics are. They are live bacteria, and they have an immunomodulating effect, which means that immunomodulators can consume the probiotics that we consume, which in turn positively impacts the health of the gut. Probiotics can also benefit the gastrointestinal mucosal barrier, and this barrier is the property of the stomach that allows it to contain acid, which is used for digestion. The probiotics help build a strong barrier, which is important because a weak barrier can allow the stomach acid to escape and cause damage to the stomach. So why are probiotics important? They help promote beneficial effects on things such as diarrhea, for example, Clostridium difficile, which we will go later into depth in this PowerPoint. They also positively affect allergies and IBS and IBD, which stands for irritable bowel syndrome and inflammatory bowel disease. In this research study, 2 different types of probiotics were used to compare their effects on the human intestinal microbiota amongst 10 patients. The first group consumed Lactobacillus buchneri for the first 4 weeks, followed by the addition of probiotics for the following 4 weeks. The second group of 5 consumed the probiotics first for the first 4 weeks, followed by the Lactobacillus buchneri for the following 4 weeks. Fecal samples were collected before and after each consumption, and human fecal microbiota were analyzed. The results showed that those that consumed the probiotics increased good bacteria, whereas the Lactobacillus buchneri decreased good bacteria. This demonstrates the need for compatibility selection of probiotics with each individualized intestinal bacterial flora. So when we're picking probiotics for patients, it may be beneficial to look at their bacterial flora and determine which probiotics would be most beneficial that way. I mentioned earlier on that probiotics can benefit things such as diarrhea. So Clostridium difficile infection is an example of an infectious diarrhea. This can cause apoptosis of the mucosal epithelium. In a randomized control trial, 33 patients were studied that had this Clostridium difficile infection. These patients were either given a capsule of a 4-strand probiotic or a placebo, and 1 capsule was taken for 28 days. Whichever capsule the patients were taking had an addition to standard antibiotic treatment as well. So the results showed the days with diarrhea was significantly lower in patients who consumed the probiotics rather than the placebo. So they had diarrhea for a smaller amount of time. Several double-blind trials have found that administration of various probiotic organisms can prevent the development or reduce the recurrence of this Clostridium difficile infection. The present study demonstrates that probiotics can also be used as an adjunct to antibiotic therapy to accelerate recovery from Clostridium difficile associated diarrhea. So what does this all mean and why does it matter? Probiotics have the ability of benefiting several medical issues, which can be used later on in all of our careers. Probiotics will be most beneficial if they are chosen based on certain circumstances. Probiotics should be selected not only for their quality, but for their compatibility with each intestinal bacterial flora to be most useful and most beneficial to somebody's gut. And there has been several research studies indicating that taking probiotics is more beneficial than not. And here are a few of my references. Thank you.